Hi, my name is Dr. Mark Witcher. I'm a neurosurgeon with Carilion Clinic Neurosurgery, and I'd like to talk with you about our treatment options for epilepsy. We offer the only comprehensive epilepsy treatment in the region, and this includes everything from diagnosis to localization to treatment. Specifically, whenever we look at epilepsy, we look at several kinds that we can treat. These include temporal lobe epilepsy, which is the most common, lesional cases, or cases where we can find something within the brain that we can treat using imaging and other modalities, non-lesional cases in which we don't have that finding on imaging, and then also generalized epilepsies. When we think about temporal lobe epilepsy, as I mentioned before, it's the most common epilepsy that we see in a surgical epilepsy center. In the past, the treatment options included temporal lobectomy as well as selective surgeries, which would go after specific structures within the brain. However, each of these required an open approach to the brain. What we have now is the ability to monitor for temporal lobe epilepsy with minimally invasive approaches, as well as to treat it with minimally invasive approaches. On the diagnostic side, where we monitor for it, we actually can use a technique called stereo EEG, which instead of requiring an open approach to the brain, we actually have a closed approach, minimally invasive, where we can place electrodes selectively into regions of the brain that allow us to localize your seizure focus. From a treatment standpoint, we also have laser therapy, which allows us a minimally invasive approach to be able to treat the seizures. And the outcomes are very good with very minimal complications. When we move outside of that to lesional epilepsy, we can use the same approach of stereotactic EEG as well as very advanced imaging modalities to localize the focus of the seizure. Once we've found it, we can then use standard approaches, which include resection or disconnection of that focus, as well as laser ablation of that focus. We also have a new strategy called neuromodulation, which allows us to put in electrodes which will listen or record seizure activity and then stimulate it in a very specific way in order to stop it. This is a device similar to a pacemaker which is implanted to the brain, which allows us to control your seizures and reduce the number of seizures you have, and in some cases eliminate them completely. We also have strategies for generalized epilepsies such as vagal nerve stimulation that allow us to treat epilepsies which can't be localized to a specific region of the brain. All of these are very good options. They're all great alternatives, and they're all very tailored to the type of epilepsy that you may have. When you come to Carilion, we'll be working together as a comprehensive team in neurology, radiology, neurosurgery, and neuropsychology so that we can find the best option for you as an individual patient. Thank you for watching.